Joined now by Kim Mooney, the owner of Practically Dying, an end-of-life consultation company. Basically, you deal with patients who are going through this every year. We chatted earlier this year about the law and where it was, but 1 year into it, it's probably a good idea to see where we are. So you heard Herb and Kathy's story. They had trouble in the beginning finding a doctor. Where are we now? Is it easier to find a doctor than it was before?
I think it's easier, but it's still not public. There still is no list. There never will be. I think more people have been out on their own and have been able to locate a doctor and then done the work to locate a consulting. But it's easier, but it's still not going to be a breeze. We're still looking at physicians getting educated. A lot of them, once they actually find out, they can connect with Compassion and Choices, what it's about, how it works, and are more comfortable, they're coming out.
Yeah, it makes sense. Compassion and Choices now has a tool where you can find healthcare systems, but doctors are less likely to be out there saying, I do this.
Absolutely.
Why is that?
Well, a couple that I know did it for 1 or 2 people and were inundated by, not hundreds, but many other people wanting the help. And there's a certain amount of integrity for physicians. First of all, this is a big shift for them, thinking about how to help end a patient's life. But the second thing is that they really want to know the patient. Nobody's taking, cold calls. They have an integrity about how they're going to assess whether the patient has mental capacity. What's really going on with them. That's part of the assessment. There are some pretty rigorous pieces to this to make sure that it isn't done casually. Not
to mention, I assume doctors have other cases to deal with, and so it's just one of those cases where if you're getting inundated by phone calls, it's got to be a little difficult.
Exactly.
What about weak parts of the law?
Boy, there are a couple. This is considered in most states a pretty solid law, but one of the things we've seen is what the argument is equal access. For example, people who cannot self-administer this, people with dementia, people with advanced ALS, anyone who can't self-administer can't have access to it. So that's an ongoing issue, and I think that's an issue that we're going to see around the country growing. There are a lot of ethics committees and systems that are really trying to expand how the law is. We still have a lot of education to do in Colorado. We've done a lot. Compassion and Choices has done a lot. I've done some. The health systems that are involved in this now have done a great job of working internally to make sure that their staffs know what's going on and how to navigate patients through it. I think the education is going to have to be ongoing. As we get more sophisticated, the education is going to be more sophisticated.
Is it less possible for people? We've heard a lot about the drugs lately and the cost of those drugs. Herb and Kathy, for example, $4,000 for that Seconal, which is the drug that they used. On the other side of the coin, we've heard stories from some folks who say they've taken a less expensive drug and had problems with it. Are the drugs an issue?
I think the drugs are always going to be an issue, but I don't think that there's a clear line between the morphine cocktail not working and the Seconal working. There are at least 2 levels of that. A lot of people are concerned that it hasn't worked because it didn't work as quickly as they thought, and that's another education piece. Dying is a hard business. Bodies don't die when we think they should. There have been times when the Seconal has taken 15 hours too. So we're hearing about the cases that don't work, which is a good thing, but because of the low reporting requirements, we don't know how many times anything works or doesn't work.
Yeah, because so we have numbers from Compassion and Choices right now. That's the only group that's reporting any number, and they're saying 45 to 55 terminally ill patients have received the prescription. They've had it filled. They haven't necessarily taken it. And in a lot of these cases, we've heard people don't end up taking it. When the numbers do come out from the state, we won't know much, right?
Right. We will have very little data. We'll know which prescriptions were written, but we won't know who took them, how they went. We won't know what the situations were, whether there were issues or not for a lot of that. Yeah.
And the advocates kind of push for that because of a privacy level, but at the same point, doesn't it seem like it would help advance the cause if we knew what worked and what didn't work?
I believe it would. Personally, I believe it would.
What would that tell us?
Well, I think that first of all, what's working and what's not. Who's actually selecting this? We know a lot of these people, 90% of them hopefully, are in hospice, which is the ideal way to go. You're surrounded by a system of professionals who aren't afraid of death and who can actually walk you through some of the other parts of the death system. So let me say something about that. As we open this up, we also find that coroners don't understand exactly how they're supposed to relate to this. And funeral directors, so this whole death system has to be educated about how to work together and what to expect. In terms of the data collection, I wish that there were more. I think that it would help us understand It would help us understand how the whole thing is working. And basically, because it's been done in other states, I think there's an assumption that we don't really need more data. I believe we do.
Because state to state, it's different in each state, right?
Yeah, I mean, there's some similarities. The people who've accessed this tend to be more affluent, tend to be white. They tend to be people who have a fair amount of education. And we would like to see that also expand. We'd like to know why and how we can make changes there. So even though the data in the rest of the states, we have more data, I think that it would be important for us to understand our population and how it's working here.
Hard to play forecaster, but if you and I were to sit down a year from now and talk about this, what do you see happening in the next year?
Well, I hope, this is very developmental where we are. I hope that we would see more open conversation about it. I would hope that we would see more health systems and more physicians comfortable with it, and that would create more of a network of consulting physicians also being available. We would see more pharmacies involved, so it would take people less effort on their own part. As you heard with Herb and Kathy and with this other story, people are doing a lot of legwork on their own, and when you're dealing with a stressful terminal illness, that's not something that I don't think you need to be dealing with.
Yeah. You've dealt with some patients who've made this choice. What's your experience been this year?
Well, recently I had a personal client that I've been working with for a while who was just an incredible man who was very well versed in medical aid and dying, and when his lung cancer got so bad that he was in pain constantly, he said, I want to get hold of the prescription. He had trouble. His doctor was very supportive. They had trouble finding a consulting. So they spent a fair amount of time, which again was time I would hope he hadn't had to spend. He did get the prescription, psychological insurance. He felt good about it. And then one day he called me and just said, today's the day. It was very clear. I felt very comforted by knowing that he had made the choice he wanted. And the other thing is, because this is such a private law, a lot of people, for example, he was very discreet. He said he was discreet because he didn't want to have to deal with other people's feelings. And so when he died, he had written a beautiful obituary in which he thanked his family, he thanked me, he thanked Compassion and Choices, and then he thanked all the women who had ever danced with him. So it was a beautiful end the way he wanted to. It reflected the way he lived, and that's what we're hoping for.
What advice do you have for people out there if they're thinking about this, or they're just in the early stages, they may just be even starting to try to find a doctor?
I think it's important to be very educated about what the law is about. I think it's really important to talk to your families. You know, one of the benefits of this really is that you have a chance to, I don't want to say design your death, but really make sure that everybody in your family is on the same page or understand what's going on. So that to me is one of the biggest pieces. Early on, be information gathering, but open up difficult conversations so people have a chance to think about them, reflect, talk about them, and be part of that closing for you.
Kim Mooney, thank you so much for coming in and chatting about this. We really appreciate it.
Thank you.